Recognize the gentle lady from Wisconsin, Ms. Moore.
Thank you so much, Mr. Chairman, and I too want to thank you, Secretary Becerra, for coming to my district and really doing an amazing job to educate my community about the importance of the various investments that have been made in our community. Just very quickly, I'm looking at your written testimony, and on page 5, you said the budget also proposes to further expand the healthcare workforce by allowing community health workers to be able to bill for select services under Medicare. Can you share with me what those might be? That's very exciting.
I'm sorry, can you pose the question?
Your written testimony says that you're going to allow community health workers to be able to bill for select services under Medicare.
We're trying to move both the Medicare program and the Medicaid program to a space where we make access to services more readily available, because one of the things that we found, Congresswoman, is that too often people are deprived of services even though they're eligible for them because they don't know how to access them. And so whether it's in Medicare or Medicaid, we're going to do everything we can to make sure access is made most available.
Thank you, Mr. Secretary. I am so pleased to see that this is like a dream come true, to look at a budget that's really centered around children and women, and I don't have enough time to address everything, but I was curious about the foster care provision that was just came on board in January 2023 that would enable foster youth to have Medicaid through age 26. And I am concerned about the implementation of that program, whether or not there is a sort of plan to contact foster youth who may or may not know that have aged out of foster care that they are still eligible for Medicaid.
Yeah, that's one of the biggest issues is when you leave the foster care program, sometimes there's no safety net to catch you. We're going to try to do what we can to follow up. Simply because you turn a particular age, 19, 21, depending on what it is, it shouldn't mean that all of a sudden you fall over a cliff when it comes to the services that you need. Some of our foster kids, as you know, are the most in need of service. They're the ones that are calling the 988 suicide prevention hotline more often than not. So we are going to do everything we can to make sure no foster care child believes that they are second class.
I am really happy to see that that you're very intentional about moving into mental health. And you know, we talk about mental health parity all the time, at least as long as I've been a member of Congress. And so I'm wondering what, in particular, that we wrap our arms around, are you doing to make sure that mental health parity is more than just a conversation?
Congresswoman, we're doing as much as we can to get insurance companies to follow the law. And so that if you are at an insurance company and you provide reimbursement for physical health care benefits and services that a patient receives, that you are also providing reimbursement for mental health services in an equitable way.
This is a really big problem. I mean, you know, for women postpartum have severe depression, and it has a real impact on the well-being of the entire family. You know, when mama ain't okay, nobody is okay. I yield back.
Gentleman from Florida, Mr.